But I think for patients, Liz is quite right. We are far too paternalistic. I don't think they lean on us. I think we grab them, we disempower them. And I think we've just had a bit of a shock of, actually, they don't need us. They can do this. So I think there'll be a huge ask for patient information leaflets, patient information apps, empowering patients. Got all these long-term conditions, log on to a website and answer a questionnaire, and that will categorize them as whether or not they actually need seeing. Because when we've got this bow wave of unmet need, how are primary care, community care and hospitals going to gather the lists of people who need to be seen, triage them, pull them in, make sure they've been seen, and then somehow take them off that list? Now, we don't have the infrastructure to do that because we assume that the old system's still running. Referrals come in, we do certain things with them, we see the patients, we tick a box, they go off the 18-week list and off they go. There is no infrastructure for seeking people out, triaging them and getting them seen. So I think that'll need doing. I think there'll be a big need for doctors and patients to keep the bits that are good. So video consulting and everything else is brilliant, but that's not how clinicians are trained. We're trained hands-on, face-to-face. So I think we will keep video consulting and everything that Liz is describing, but we need training because you triage in a different way. I've worked for the GP out of hours service. I'm quite comfortable to speak to a mum of a hot child and not admit that child, but that took me years. I worried about the first 100 that I spoke to. So we're going to have to retrain our clinicians to be able to triage on the phone. You ask different questions, you write down different things in the notes, you give different advice.